At that time, you may press star 1 on your phone to ask a question. I would like to inform all parties that today's call is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the conference over to Madhavi Reddy. Thank you. You may begin.
Hi, thank you so much. I want to thank you for joining the 9th Evaluation Capacity Building webinar for the HRSA Pediatric Mental Health Care Access and Screening and Treatment for Maternal Depression and Related Behavioral Disorders program. Today, ABS will provide an update on HRSA MCHB evaluation activities and share next steps. And after that, HRSA will provide information on upcoming HRSA-required reporting activities and reporting changes. We look forward to sharing more about the evaluation data collection with you today and hearing your comments in the question and answer session to follow. So now I'm going to turn the webinar over to Susan Hayashi to provide a welcome and some brief housekeeping information before we start the webinar. So thank you everyone for joining and participating today, and I'm going to turn it over to Susan. Thank you.
Thank you, Madhavi, and good afternoon, everyone. As Madhavi said, this is Susan Hayashi, and I'm with JBS, and I'm the project director on the HRSA MCHB evaluation contract. We're happy to have you join us today. Can't believe we're on the 9th webinar for this project, and it's just really nice to connect with you in so many different ways. Before we get started, I've got a few housekeeping details regarding the webinar logistics. For roll call today, please enter your state and program name, that is PMHCA or MDRBD, into the chat box located on the left side of the screen and push send. So it might be RI for Rhode Island, PMHCA, or something like that. So at the end of today's presentation, we will have a question and answer session. Please hold all questions regarding the presentations till the end. When it is time for the Q&A, we will give instructions on how to ask questions. You can also type your questions in the chat box. If you're having technical difficulties during the webinar, please use the chat box for assistance. Please type your question in the chat box and push send, and someone will connect with you as soon as possible. Today's meeting will be recorded, as we've said, but once the recording is available, a download link will be provided for all awardees. So in terms of where we are with the evaluation, we're going to spend just a couple minutes here for, as you know, we are in the middle of the administration of the surveys. And then that will close in, as we're moving into winter here. And then we will start the evaluation capacity building technical assistance calls with you again. So those will be in, we'll start scheduling those in January, and you'll have those over kind of the January, February timeframe. And then we'll have the annual presentation to awardees webinar that will be in the spring. And then we'll have additional webinars that will be coming in the summer of 2021, as well as the second administration of the healthcare provider and practice level surveys. So it's we're moving right along here in the implementation. In terms of the purpose of the evaluation, we're putting this in here more for context. We know new staff on board, and just that there's a bigger context of what we're talking about, and why this evaluation is being implemented. And it's really to determine the outcome and impact of the programs, the PMHCA and MDRBD funded programs, healthcare providers' capacity to address patients' behavioral health and access to behavioral health care. So to allow HRSA to be able to look at, how are these programs working, and be able to share with others that, the impact or modifications that might enhance the programs over time. But that's why the evaluation becomes so important, and also leveraging the data that you collect through your programs. As I mentioned, again, this is more just for a reference. We've got the 3 major data collection activities. Thank you again for providing the program implementation surveys. And then now we're in the midst of collecting the healthcare provider and practice level surveys. And in terms of the administration approach, some are JBS administered and some are awardee administered. And this is the breakdown of the approaches with the states. And I think with the calls that we had over the last week, you got to hear some of the different experiences and perspectives from that. And then through the accomplishments to date, like I mentioned, 100% participation in the program implementation survey. Really appreciate that. Making use of the promotion packet materials in creative ways that's being done. And then we've got now with the survey administration that's ongoing, the reminders that are going out. And then right now we're planning on having the surveys close at the beginning of December. Now I'm going to turn it over to Amanda Gamerick.
Great. Thanks, Susan, for that review, and hello, everyone. I am Amanda Gamerick, the evaluation lead for the HRSA MCHB evaluation. Next, we want to discuss some of the methodological decisions that have been made as survey administration has been progressing. Some of these decisions were made pre-administration and shared with you in late August as we were preparing for survey administration and collecting email addresses from awardees for whom JBS is administering the surveys, as well as sharing the email address template with awardees who are administering the surveys. Pre-administration, the 2 main methodological decisions were how to handle survey administration for sole provider practices, as well as for programs that do not enroll practices. And so for sole provider practices, the decision was made to only administer the healthcare provider survey and not the practice level survey to limit data collection burden to these sole provider practices. For programs that do not enroll practices, only the HCP survey is being administered here for these programs. There is no practice level survey administration for these programs. So in addition to these, some methodological decisions have been made during survey administration based on questions and discussion with awardees and with HRSA. So, we talked about some of these methodological decisions during the survey data collection calls that we held last Thursday and this Monday, and we want to thank you all again for joining with us on those calls and sharing with us. And Susan is going to talk a bit more about what we learned during those calls in a bit. But one question we've received during survey administration has been how awardees can see who has responded to the survey in order to target their reminder communication. And so the answer to this depends on your administration method. For JBS-administered surveys, we have been providing weekly updates with the email addresses of individuals who have completed the surveys so that you have that information. And then for awardee-administered surveys, we are able to provide you with the number of individuals who have completed the surveys, but are not able to track who has completed the surveys. And so this was one of the methodological trade-offs that we discussed during the TA calls last winter of awardees administering the surveys. So while providers and practices may be more likely to respond since the survey is coming from a familiar email address, we do lose the ability to track who has responded. We have also had questions about making adaptations to the OMB-approved email templates that are being used by awardees who are administering the surveys. And based on your questions, we have received approval from HRSA for you to make minor changes to the templates so they're more salient for your enrolled providers and practices. Finally, we've had some questions regarding resending or sharing of the survey links. Currently, survey links may not be shared outside of the OMB-approved email templates. However, I should note that based on our discussions, we are exploring changing this approach with HRSA, and we'll keep you posted on any updates. On the next slide, we wanted to talk a little bit about survey responses to date. So as we discussed in our survey data collection calls, survey response rates vary across awardees and across surveys. And we wanted to give you a picture of how survey responses currently stand overall, since we are about at the halfway point of data collection. The numbers on this slide reflect the number of awardees in each response rate category. You'll notice that the N for each survey is different than the total Ns of 21 and 7 for the PMHCA and MDRBD programs respectively, and this is for several reasons. The first of which is that some awardees did not have enrolled providers as of July 31st, and therefore the surveys are not being administered. Also, as we discussed earlier, some awardees enroll providers but not practices, so the practice level survey is not being administered for those awardees. And then for awardee administered surveys, we have not received the completed Excel tracking sheet for some awardees, so we do not have information on the number of individuals to whom they sent the surveys. And so we aren't able to calculate a response rate, so those awardees' information is not included here. And just a reminder for those awardees who are administering, so please remember to provide that completed Excel tracker to JBS weekly with a copy to your project officer so we have that response rate information. So again, you can see here that response rates vary, with many falling in between the 1 to 20% range across awardees and across surveys. So now I'm going to turn it back over to Susan to share some of what we heard during the small group survey data collection calls from last week and this week. Susan?
Thank you, Amanda. Well, as Amanda mentioned and I mentioned, it was really a pleasure to speak with you, and I really appreciate everyone jumping on those calls so quickly. What we really wanted to be able to do was in advance of this discussion today to get a better sense of where we are in terms of the survey data collection and any adjustments that could be made as we go into the second half of that. And here in summary, what we heard were that there are contextual factors affecting the program implementation and also the survey administration. So for example, COVID-19 and hurricane season and some of the tremendous storms that have impacted some awardees. It's very impressive in terms of how you all as programs are committed to coordinating with HRSA and JBS to support the evaluation. And, in some cases we've been able to achieve, response rates of greater than 40%. And what we're, that speaks volumes around your commitment, but also the communication that we receive, the questions that you ask, really allows us to look at different elements of the evaluation to maximize the success of it. The engagement with the program has a potential to impact participation in the surveys. So what we're hearing, there's kind of a push and pull effect where for the more engaged providers and or practices are, they're using more services, they seem to be responding more to the surveys. The flip side is also with some of the promotion of the surveys, some awardees have seen, a number of awardees have seen greater engagement in the program, kind of that reminder that it's there. And so, and the relationships that are built with the providers seems to be paramount, and being creative in how to do that when you can't do the in-person visits and engagement, whether it's phone calls or different types of connections. And then the use of the promotion packet and materials and the language, and then being able to tailor that. It's not about sending more emails, but it's about having ready information to be able to use and tweak and figure out how to incorporate that that has been helpful to promote both the programs and the surveys, which, and in the context of getting feedback. And, and seeing that as kind of an element of use of the programs as well. So all those elements, at the end, we'll connect back in terms of kind of next steps and future directions. And then also, as Amanda mentioned, we are working with HRSA and looking at what flexibility there might be to send out individual links, and we would be able to look at that as well. And then in terms of the questions that we're receiving about sharing the survey links, that's something that we will continue to, we'll get back to you on, because we're able to do that. So we know time is of the essence to allow that to happen, so thank you. And now in terms of being able to talk about the promotion packet, I'm going to turn that back over to Amanda.
Great, thanks, Susan. And hopefully everybody can hear me a little bit better. It sounds like I had some audio quality issues before. But so thank you for that review. And again, to all of the awardees for all of the helpful information that you shared. So Susan did mention the promotion packet just now, and we wanted to talk a bit more about the promotion packet and see how it's been going for you with using those materials. So just for a quick review, everyone should have received the promotion packet materials in early September with guidance about how to use these materials that are intended to increase program engagement, encourage completion of the surveys, and work with champions to share these materials. So we've provided a range of materials for your program to use as you see fit, from social media messages and email text to graphics and PowerPoint slides. So we have a few quick polling questions that we want to put out just to see how programs are using these materials so far. So on the next slide, here is polling question 1, which is what promotion packet materials have you used so far? And for this one, you can please feel free to select all that apply. And if you haven't used any yet, just go ahead and choose that option. And so we will give a few minutes for people to respond, or a minute or two, and then broadcast those results. All right, it looks like the responses are staying pretty static. Just a few more seconds if you want to chime in about what promotion packet materials have you've used so far. I'll give another few seconds, and then we'll go ahead and share those out. All right, it looks like we're not getting any more responses. So Erica, if you want to share those results, that'd be great. And I'm not sure if folks can see these results now, but it looks like the most commonly used materials have been the email messages. 67% of people who responded said that, followed by the drop-in text, the Canva graphics. A few folks have not yet used any of the promotion material, so it looks like a range of options have been used, with the most common being the emails. I'm going to go ahead and move on to our next poll. And for this polling question, here we have, how frequently are you distributing the promotion packet materials? Oops. And so we're going to go ahead and publish that poll so you all can vote, and give you some time to vote here. looks like we still have some people chiming in, so we'll go ahead and give another minute. Great. And Erica, can we broadcast those results? And hopefully everybody can see those. But it looks like most people who responded, about 60%, said that they have distributed the promotion packet materials, but only occasionally, so once or twice. And behind that, it looks like the next largest group was distributing the promotion packet materials on at least a weekly basis. And again, we have heard questions from awardees about the frequency with which to share those materials. And so it looks like people are kind of between weekly or occasionally. Going on to the next slide and our last polling question related to the promotion packet materials. This question is, have you engaged with a program champion to share promotion packet materials? And so we'll go ahead and open that poll and let people go ahead and vote. All right, it looks like we're still getting a few more votes, so we'll give it another few seconds and then share these results. Great. It looks like responses have stopped coming in, so we can go ahead and broadcast these results, Erica. And then for this one, it looks like, for the most part, the largest percentage of folks have not engaged with a program champion to share the materials. Some people have, and fewer are kind of in progress with this process. So thank you all for sharing that information with us. We just wanted to kind of get a sense of where you are with the promotion packet materials. I know we talked with everybody during the survey data collection calls about the materials and how you're using them, but just wanted to give kind of a broader group sense of where things stand with those materials. And like we've seen, it looks like emails are kind of the most popularly used materials. People seem to be implementing them weekly or occasionally, and so far it looks like the largest group hasn't yet engaged with a champion to share those materials out. So moving on to the next slide, we wanted to just give a quick promotion packet update here. So this slide provides an update on activities to date as well as upcoming promotion packet activities. So we appreciate all that you've done in sending and posting communications to date. And then regarding next steps, we do recommend that you continue to share the materials on a weekly basis through the duration of survey administration as shown in the slide. Like I said, we have been hearing from awardees with questions about how to use the promotion packet materials, and we'll talk a little bit about some of those questions next. And we'll continue to check in with you about any questions you have, as well as seeing how engagement with your program champions is progressing. So in terms of some of the kind of FAQs that we've been getting around the promotion packet materials, we just wanted to share some of these out with you. So again, we've mentioned a couple of times the questions that we've received around sharing of the survey links. And again, as Susan just mentioned, to date, the guidance has been that we are not sharing the survey links outside of the OMB approved email templates that awardees who are administering are using to administer the surveys. Again, as Susan mentioned, we are kind of revisiting that approach and coordinating with HRSA to see about revising that approach and being able to share those survey links out. In terms of dissemination of the promotion packet materials, we have had some questions about whether JBS is sending those out on your behalf or whether awardees should send. And the idea here with the promotion packet is that whether you're administering the surveys or whether JBS is administering, that you would be sending those materials on behalf of your program and being able to really choose the materials that you see most fit for your program. And then finally, in terms of limiting provider burden and limiting email fatigue, which we've had some questions about, and again, we saw that the emails were the most popularly used materials. We did provide a range of material options as discussed earlier. So to kind of limit that provider burden, some other ideas would be to, instead of using the email text, consider using the drop-in text and or graphics in your monthly newsletters or training invitations, or adding the PowerPoint slides to your training materials, just to kind of mix up those communications. So with that review of the HRSA MCHB evaluation survey and promotion packet status and information we heard in the survey data collection calls, we wanted to provide some ideas about next steps for maximizing survey responses. And I am going to turn it back over to Susan for this section. Susan?
Thank you so much, Amanda. As was mentioned, there's about 1 month left in the survey administration, and now we have started providing the survey response rates, or the number of responses, weekly, so you can, for your own reference, but also if it's appropriate with your providers, to show progress and encourage enrolled providers and practice managers, practice leadership to provide feedback. So each of those pieces would be helpful. In terms of the really attempting to do more targeted outreach, is there any trainings or webinars that you have upcoming, in-person trainings, which we know is severely limited at this point, but making that connection, also having directly calling or asking them to complete the survey, that's a way to do it as well. That can also build engagement around the program as a whole. So that personal touch seems to be an ongoing theme based on what we heard from you, and seeing some results for that. And then also being able to use the promotion packet in different ways. I will say it's for, I think there was one participant who responded to the polling where they're not sure how to use the promotion packet. If you need any guidance, we'd love to hear from you, and if you just let us know, I could use some help, or I was thinking about this, can do anything else that you'd recommend, please just send us an email, and we're happy to provide guidance around that. I know a number of you have indicated that you don't have a program champion at this point, and we really recommend that as a way to help with promoting your program, and then also kind of norming the need to provide feedback and participate in the evaluation surveys. Those champions really can be an important voice for showing how beneficial these programs can be to increasing access to behavioral health services within your state or program areas. And then for awardee administered surveys, considering adding language that asks providers and or practices to update you if they have completed the survey. A number of awardees shared that that seemed to be helpful to say, hey, let me know, then I'll take you off the list that we're doing, and that was making a difference in terms of the response rates. So some of the pieces that we heard from you overlaid with that real passion for engagement within the programs. And that, I think, can be beneficial overall. So that's those are recommendations coming out of the calls and ways to approach this. And if you have any questions, please put them in the chat box, or you can ask them at the end. But at this point, I'd like to introduce and turn it over to Madhavi Reddy and Ashley Belton. For those of you who I don't know, Madhavi is with the PMHCA program, and Ashley is with the MDRBD program. and she's the project officer for the PMHCA program. And Ashley is a project officer for the MDRBD program that I mentioned, and they'll be discussing the HRSA-Required reporting, the due dates, helpful guidance, and observations that they're seeing in the data as that's submitted. So I will turn that over to Madhavi and Ashley.
Hi, Susan. Thank you for the introduction. Once again, this is Ashley Belton. I'm the project officer for the MDRBD Awardees. And during this next session, Madhavi and I really wanted to go over some upcoming reports that will be due really in the end of, well, in 2020 and in January 2021. So I'll just start off with some reminders for the MDRBD awardees. We do have several reports that will be due in the end of January. First, starting off with that Ncc Performance Report and that Form 10, also known as the DGIS. That's right now available in your EHBs. And you can start filling that out. And we do have a few tip sheets at the bottom of your screen that you can download to review on how to complete that. And that's going to be due on January 28th, 2021. We also have the Ncc Progress Report, which is our annual narrative report. That's going to be due in mid-June. So you have some time before that. There's the FFR, the Federal Financial Report, and that will be due also at the end of January. And lastly, we do have the first quarter of year 3 quarterly congressional justification measures for the MDRBD awardees. Those are our 3 screening measures for depression, anxiety, and substance use disorder, and that will be due on January 30th. But that will look at that time frame from October 1st to December 31st. And that should be available soon in your EHB. And right now, I'll turn it over to Madhavi.
Hey, thanks, Ashley, so much. So, yeah, I mean, just piggybacking off of what Ashley said in terms of the Pediatric Mental Health Care Access Program, we actually have 2 cohorts, a group that was funded starting in fiscal year 2018 and a group that was funded starting in fiscal year 2019. So they have different reporting dates and reporting periods. So just to go over the 2018 awardees, your Ncc Performance Report in Form 10. Your Ncc Performance Report is, well, both reports are due on February the 11th. And all of you should have the Ncc Performance Report and Form 10 in your grant folders. So if you have questions about the Ncc Performance Report and Form 10, we'll be going over that a little bit more in a few minutes. But if you have questions, just feel free to reach out to your project officer. Also, there's an Ncc Progress Report due. That will be due June 16th of 2021. So that will be actually your next progress report. So you don't have to worry about that right now, but that's just an upcoming date to keep you informed. And then you have a federal financial report that's due on January the 30th of 2021. And I caught something on the slide here. Federal financial reports, they're still due annually 120 days after the end of the budget period, but they're due in the payment management system now, so not the electronic handbooks. And I think many of you probably attended a training about that in terms of like how the report is due in the payment management system now. Of course, if you have questions about your federal financial report, how to complete it, how to submit it, feel free to reach out to your HRSA grants management specialist. In terms of the fiscal year 2019 PMHC awardees, you had a performance, or you have a performance, you had a performance report due on October the 29th, which is past, so your project officers should be reviewing that performance report right now. Form 10 is due November the 13th, so you have a little bit more time to complete that. In terms of progress reports, your next progress report is due March the 17th of 2021, so that's coming up in a few months, and you'll you should receive guidance on that about a month before the report is due. So, anticipate receiving instructions in February for that report. And then finally, your federal financial report was due 10/30/2020. So those reports should be in now, and that is an indication that you can start working on your carryover request if you haven't already started on your carryover request. I believe some of you may have submitted them already, so so that's good news. So and then I think next slide, please. So now I'm going to turn to talking a little bit about helpful guidance on HRSA required reporting for the PMHCA program. There's several documents in the file share pod that I encourage you to download. You already have these documents, or you should have links to these documents. But if you don't have these documents already readily available, please download them from the file pod. So I'll go over Form 10 data collection forms in a little bit of detail, as well as the PMHCA general data template and the guidance for PMHCA reports and measures. And then once I'm done, I'll turn it over to Ashley to talk about helpful guidance for the MDRBD awardees. So in terms of Form 10, we actually conducted a walkthrough last fall with all of the awardees on Form 10, which I know that seems a while ago, so we wanted to kind of just give you an update about Form 10 and some of the updates that we've actually implemented with Form 10. So if you have looked at Form 10, you'll probably notice that updates have been added. They don't change the format of the form, but we've provided additional instructions and guidance in the spreadsheet so that you can in terms of reporting data, it'll be a little clearer in terms of the guidance that we're providing for you to include data in that spreadsheet. We've made some clarifications on how to provide data in Form 10. So we've also conducted a recent webinar that is a walkthrough of the updated Form 10. We shared the archive link with all the awardees. But if for some reason you can't locate the link and you would like to review the recording, please let your HRSA PMHCA project officer know, and we'll share that link with you. Just a reminder, keep in mind that Form 10 is a MCHB-wide form, so we're fitting our data for this program into these forms. So, be sure to carefully read the instructions to understand the information that we're looking for in Form 10, because multiple programs in the Bureau use the form. So the items that are not necessarily applicable to PMHC, grade them out. So if you notice that there's columns or rows that are grayed out, that means that you don't have to enter data into those rows or columns. As you know, that the measures in Form 10 have 4 tiers that you can enter data into, and we'll go over in a little bit of detail those tiers. So in Form 10 for PMHCA, there's 3 measures that we're asking you to report data on. There's the Capacity Building 8 measure, there's the Child Health Measure number 5, and the Adolescent Health Measure number 4. So in Capacity Building measure, Capacity Building 8, as I mentioned, there's 4 tiers. And Tier 1, most, or if not all, PMHCA programs should be selecting yes, that you promote and or facilitate provider capacity to screen, refer, and treat patients. So then once you enter or select yes for Tier 1, Tier 2 should open up. And in Tier 2, we're asking you through what activities and mechanisms and in what areas are you promoting and or facilitating provider capacity to screen, refer, and or treat MCH patients. So the expectation for you is to select all appropriate activities and mechanisms in this tier, and we've provided some additional instructions and definitions in the orange column in the spreadsheet for you to be able to better enter data into Tier 2. And then I'll just drop down to Tier 3. So Tier 3 is actually where you enter data. So you're actually entering, the number of X that you're doing in specific categories. So this is where you're providing the actual numbers for how many were reached through the activities or mechanisms you selected in Tier 2. And again, there's an orange column in this spreadsheet where we've added some additional instructions about tier-specific information that you should be entering. And there's also in Tier 3, in some of the columns and rows, you'll notice that there's gray italics in each of the individual cells, and those provide specifics about the data that you should enter into each cell. So I just recommend that you review the gray italicized information in order to determine what data to enter, as well as looking at the orange column that provides additional information. I think something that may have not been in the previous iteration of the form is that we've added a column for unknown provider type. In addition to being able to enter data on provider types and other provider types, we've also added an unknown column, so you can enter any unknown data for provider types into Tier 3 now. And just one last reminder on Tier 4 for CB8, even though the tier is not mandatory, if you have data for Tier 4, we recommend that you enter the data. And again, there's more information about how to enter the data. And then quickly, I'm just going to mention CH5, Child Health 5. This measure is also in Form 10, and it asks you to enter data on children ages 0 to 11. So we're primarily asking you to enter data that captures activities that are being delivered by providers to children ages 0 to 11. And there might be some categories in this measure in Tier 2 and 3 that refer to program partners. So just be mindful that the data that you enter in Child Health 5 could either pertain to children ages 0 to 11 or program partners. And again, there's more information in that measure to kind of direct you to whether we're talking about entering data about children or if you're asking you to enter data about program partners. And that carries forward to Adolescent Health Measure number 4. The Adolescent Health Measure number 4 is similar to Child Health 5, except that we're, of course, asking you about adolescent health, adolescents ages 12 to 21. So that's the main difference. And then there's also some information that we're not asking you for in that measure because it's already been entered into Child Health Measure 5. So you may notice that there's a little bit less information that we're requesting from you in Adolescent 4. And then I'm going to go over two more things real quickly and then turn the rest of the presentation over to Ashley. But in terms of general data template, that's also a document that we've shared with you in the past, and it's also in the file share pod. So the general data template is just for your internal tracking purposes of required measures. So Form 10 is required of you, and we've sent you a request for information for Form 10 data, but we've also provided a general data template to you. And the general data template aligns with Form 10. So this is just like an internal document that you can use and on a daily basis to kind of track data. And there, just to let you know that there are some changes that have been made to the general data template. And when you look at the document, you'll see some cells in yellow that are yellow highlighted. That will indicate the changes that have been made. And then finally, there's a guidance on PMHCA reports and measures. This provides even more information about an overview of non-competing continuation progress and performance reports in the federal financial report. It also provides you with important dates to keep in mind throughout the course of the period of performance. So I encourage you to look at the document as it provides those important dates, as well as it includes a list of all measures that you are required to report on for the PMHCA program. So with that in mind, I'm going to turn it over to Ashley now to talk about MDRBD guidance.
Thank you, Madhavi. For the MDRBD program, we also have a Form 10 to report out on those tiers 1 through 4. And that form is available through a request for information in your EHB. And we did use the Form 10 last year to collect year 1's data, and this year we're using it to collect year 2 data. Some key changes that we made from Form 10 this year is to identify the areas in Tier 3 that are required to report, and also we inserted the abbreviation for the actual no-flow measure that corresponds with the row item. So hopefully that will be easier to identify where the actual data should go in this table. We also added some more text that's grayed out to really identify, continue on what rows and information needs to be entered in that Tier 3 to make it a little bit more clear. Also, a change is that we wanted to clearly identify which sections were mandatory reporting and which sections were nice to have or optional for you to report on. In the spreadsheet WMH5, which is the Women's and Maternal Health, 5 mental and behavioral health screening and follow-up, Tier 4, all of it is required, and special attention to the measures that are identified as the CJ measures. These are your congressional justification measures that are your annual measures. So this is the roll-up of that quarterly congressional justification information that you've been collecting. Instead of the women that we're seeing for that quarter, we want the women that we're seeing throughout the reporting project period, which is that September 30th through September 29th. And the time frame is identified right in the spreadsheet, so you don't have to remember it. It's right in the spreadsheet. And we just wanted to point that out and make sure that everyone has clarity on that. We also have a tips sheet which helps walk through those other remaining DGIS forms. So we have quite a few other forms, like Form 1, the MCH project budget details and fiscal year, and Form 2, the project funding profile. And we included, listing out our required forms that you should complete, but also for those forms that might involve, like the number of individuals served, we wanted to make sure that you had a better understanding on what information should be included in there. And if you don't have that information or that level of detailed information, you can include the numbers that you do have in an unknown column. For instance, if you're not able to identify the status of insurance that the individual served had, you can mark that you did serve this patient, or your providers that were enrolled in the program did serve this patient, but you don't know the insurance, and you're able to categorize that patient under unknown column. So it's more details, more tips on how to complete the forms. We also included some information on how to fill out Form 10 as well in this document, both of the spreadsheets. And then lastly, there is some upgrades that we made to the reporting guidance and crosswalk between DGIS and Form 10. And in this large document, we do have all of the definitions that should be used to complete the DGIS forms. And we also have this crosswalk of all the NOPA measures, the acronyms that we're using that are in that Excel spreadsheet Form 10. And we also included the spreadsheet row of where you can find out how to plug in that information. We include a numerator denominator when it's required, and then there's a data source or kind of a notes section on who to include in this measure, what are we referring to when we say rural, or what are we referring to when we say contact the program. So this information is all in this document. It also has the reporting periods of what reports we're looking at, which is year 2 information. So that is the tip sheets. They're already in your EHB, but also you can download them here in the pod, and you can review those during this call or after the call. Okay, next slide. So in this section, we just wanted to go over some observations that we made from year 1 reporting. During year 1, we were aware that all programs were really in that implementation stage, the hiring stage, the engaging with providers, the promoting the program, marketing the program, hiring staff, and getting contracts together. So there were missing data, and there were some areas that if there is missing data in year 2, we would definitely want programs to clearly identify that data or explain why it's missing, and then talk to your project officer on the processes that you're taking to ensure that you can collect that data for year 3 reporting. And also we noticed that there was a need for additional guidance in understanding data elements, so hopefully the documents that I shared and Madhavi shared will assist the programs in completing these reports. And if not, or if you have any questions, please reach out to your project officer directly. So now we do have some poll questions. The first poll question, number 4, is in the following, sorry, it's blocking. Okay, okay, poll question 4. In which of the following areas does your program require assistance related to HRSA required reporting? Select all that apply, and we'll give everyone about 30 seconds or so to respond to that. Okay, it looks like the polls have stopped moving. So we can go ahead and close the poll right now, and we can broadcast those results. And it's looking like there's kind of a split on folks really needing assistance on understanding data definitions, and also there needs to be assistance on capturing screening data, and I believe that's referring to the behavioral health screening measures. Okay. Next poll question. And this poll question is an open text. So we'll give you a little bit more time to complete this. But are there any additional areas that your program requires assistance related to HRSA required reporting? And if you selected that you're needing assistance around screening, if you wanted to identify which particular screenings that you were referring to, feel free to type that in as well. Okay, that was looks like enough time. Can we broadcast some of those responses? And thank you for those responses. It looks like there's additional assistance needed around the self-efficacy, baseline, and follow-up of those screenings. There needs to be more assistance around SUD screenings and provider engagement and how to get them to respond to these data requests. And another response was around self-efficacy surveys. Thank you. And then our next poll question is, what would you say are your program's data collection evaluation strengths? We just discussed some of the areas for improvement or areas that you need assistance in. If there are any areas that you feel that your program is really excelling in, feel free to list those off now, and I'll give you about a minute to respond. Great, and thank you so much for these answers. It looks like programs do have a lot of strengths, particularly around tracking and training and engaging in outreach, collaboration with partners, really great improved communication with your contractors that you're working with. Some folks are really having great success with collecting data on those consultation calls from those providers that do call in. They get very complete information. So thank you so much for sharing these answers. And I think with that,
yep, I will.
Susan will take it away. Thank you.
Yep, exactly. No, this is great. In terms of some key takeaways and next steps, there are a couple of things that were just covered by Madhavi and Ashley that I'd like to start with. The first one Madhavi was mentioning in the Tier 3 with the unknown provider types. Some of the things that we've received questions on with the survey administration would be like that social workers, home visitor, a staff chaplain. If that's not part of your current list, those would be the types of enrolled providers who would want to capture. And I think that also speaks to a strength of this particular program that we'd want to capture in the reporting, because where it might have been conceived as a program that was engaging primary care providers, the reach and the importance of increasing access looks like it may involve other individuals as well and other professions. So being able to share that and broaden that and the knowledge that's being gained as the programs are being implemented, that's an example. I also wanted to just flag that, as you know, this meeting, this presentation is being recorded. If you need to reference that as you're then working with Form 10, for example, or any of the other reporting forms, you can use this recording to help guide that. The other thing that I want to address is thank you very much for the comments in the chat box. And the reason I want to talk about that before kind of key takeaways, next steps, is it's very helpful to hear you ask the questions about the survey links. The question is, when JBS administers the survey, there's a specific link that's affiliated with each email address. So it essentially serves as a unique identifier. And if we give you a link that then is used by anybody, can we track it back? Because ultimately over time we want to match the data. And even with the coding, we also have to be careful from OMB if we can overburden, if people can we distinguish who completed a survey, and we should be able to do it with the self-identifying code that they create, but there are some risks. So we're looking at kind of a risk mitigation of being able to use an email address and then be able to still have methodological integrity and also careful management of PII, because email addresses are considered PII, personally identifiable information. So that's what we're working through with HRSA right now, and our goal is to have a response to you very quickly about that. I hope that addresses the questions in the chat, and if you have further questions, don't hesitate to ask. And we realize timeliness is important. For example, Andrea Connor was saying that you'd like to offer a promotion card, and having that survey would be helpful. And that's the type of thing we're looking to address very quickly. In terms of the key takeaways and next steps where we're at, going back to the slide here, is that with the enrollment provider practices, they are responding to the surveys. We've got a few with no responses yet. We know some are coming based on the calls and things that we've heard. But we can continue to work with you on how to use that. And like I said, if you're having struggles with how to use the promotion packet, please let us know. Also, how to identify and engage a champion. We think that's beneficial for the program overall. And, for the HRSA-Required reporting, just want to, with the additional guidance and information that's provided and some of the refinement, want to encourage that you're not only aware of the submission deadlines, but also some of the tips and ways to do that, because when you're able to easily submit the data, and I know from the polling responses, a number of you feel like you have very good data reporting and collecting systems, and that's really critical to quickly be able to respond to the required reporting. And as always, your HRSA project officers are available. So that's in terms of kind of the direction that we're headed. We will get back to you quickly on that survey link question. And now we'll open it up to the Q&A. I see that there's one question in here that I believe you're asking if we can offer a promotion card. In terms of, yes, that would be something that you can do. I don't know if Andrea Connor, if you want to add any comments in terms of what New Jersey is thinking. And I also realize I need to let the operator in to make a comment about the Q&A and how different ways to answer questions. So maybe, Andrea, you can provide some details about what New Jersey is planning in the chat box, and then I'll let the operator talk about questions and answers, or questions.
If you'd like to ask a question, please press star, then 1, unmute your phone, and record your name clearly when prompted. If you'd like to withdraw your question, press star 2. One moment while we wait on our first question.
Thank you very much, operator. In terms of, I see Andrea's typing in the chat box, so we'll have that answer. The question that I wanted to ask was, in one of the polling questions, someone responded that the using the evaluation, applying an equity lens, And I'm wondering if whoever responded to that would be able to share how the data is being used, or that that's a strength in terms of how's that being looked at for a for an equity lens. If you don't mind identifying yourself. And while we're hopefully waiting on that response, and Andrea said they are looking at providing a gift card for those who respond to the survey. Okay, and so Kathy's going to be responding to the equity lens. Is it easier for you to call in, Kathy, or do you want to type a response? Wait a second for Kathy to respond. In the meantime, the promotion card, being able to say that is, obviously some awardees, so I think everybody knows, are able to offer incentives, some aren't, and some are using, when you either automatically completing it, you receive a gift card for your practice, or for the individual provider. One awardee is applying for a fleece jacket is something that can be received. So we've got different ways of offering incentives. At the same time, a promotion card could also be used just as a postcard that goes to a provider or practice, if you think that's an effective way to do that. And you could use that to do that. And Kathy's operator, is there a way that you could unmute Kathy so that she could comment on the health equity lens for us?
Yes. Yes, she can either dial *1 or *0, and I can open her line.
Okay, so Kathy, would you mind doing that, *1 or *0? We just wait a moment. I know she will be joining us, so appreciate everybody's patience on that. One other question that I'll put out to the group, and maybe you can respond in the group chat for others to see while we're waiting on Kathy, is based on the strengths that the programs have and having good data that's available, maybe you could share how you're using the data to inform your program or make any refinements to your program, because that's a real advantage when you've got the data working for you. And so was wondering if you could share the, okay, no problem, Kathy. And unfortunately, she's not able to join through that. But if I could ask folks to indicate how they're using the data from their programs, that's an important strength, and really allows the overall program refinement over time, or even just ease of reporting for meeting the awardee requirements, whatever it might be. I think that might be helpful to learn from. So Beth Johns from Alabama shared that they're using the data to improve their ECHO offerings and to assess the needs of the telephone consult line. And they are hoping to talk to families in the near future. So that's a very practical application with the data. I see Amanda is also from Florida, is typing something, so we can wait for her to input the information. Another question that I'll put out to the group is just asking about how you're using the data. For programs who have engaged champions, maybe you could share how your champion is working for you. And so, you know, what activities are they engaged in, anything that they're doing. And Amanda has shared that they're using the data to provide customized technical assistance and education to enrolled providers. And so that's really, you know, they're able to turn that around to actionable items for program delivery. So that's, you know, that's helpful in terms of making sure that the programs are meeting the needs of those providers. And Juliana from Louisiana MDRBD said that they're hoping to collect the data about perceived needs and resources in our sustainability and funding efforts. I think that brings up an important point as we're in the, you know, kind of at the halfway point, and being able to really start to think about the sustainability of the programs and what that will look like and what your information needs are going to be to support that. So anything around that would be important or helpful to make sure that you have in place, or how you can leverage your data. You know, is the legislature needing to see something, or how, or are there different ways that you're planning to show the reach of the program and ongoing funding efforts that might be needed? So thank you all for sharing those insights. Any comments on the program champions that you'd like to share? Folks who've had award or awardees that have had success in engaging a champion and something that they've done that's been particularly helpful for your program? Give a minute to complete that. The other thing that I just want to give a heads up about, as we're waiting for any comments about the champions, is that you know, as we sort through the survey links, and you know, I'll say cautiously optimistic that we're able to provide that you can use it in your promotion materials. You just want to make sure that you're only going to be sharing that link with providers in practice in the original group who were receiving the surveys. So, you know, that's the type of thing that will become critical, that we're not expanding beyond that original list. So that will be guidance that we would come out with as part of, you know, what, if we're able to share the links with you, but that'll be an approach that we take. Well, so, and then Leah, thank you for sharing, shared in terms of in the chat box here, for using the a champion. They've used a provider and family quotes to show that PCPs and others. And so if you can attribute directly to a healthcare professional, this was great, really helped me meet some behavioral health needs with my patients, or a family who received care. And you can also do it where the healthcare professional isn't identified, and you can, based on anecdotal feedback that you're hearing, you can craft some quotes that would show, you know, a pediatrician or a gynecologist, you know, shared that, blah, blah, blah. Sometimes healthcare professionals are hesitant about sharing their names or attributing their name to something, but if they are, you can still kind of adapt maybe something that you've heard, and we use that as a way to support engagement. So those are different strategies to use it while maintaining confidentiality if that's what a champion prefers, but how you're able to put that together. And I see Juliana's typing something, so take your time, and we'll get that get your comments in there as well with this. And this Juliana is asking, has anyone tried videotaping a testimonial from a provider who isn't concerned about confidentiality, of course? Has anyone put together a video or a quick clip of something that would allow you to promote the program ultimately? Has there been any success? Getting a few responses here. From Virginia Pmhca, we just started collecting some videos and are planning to use them at their annual stakeholder meeting. And Beth from Alabama shared they're starting structured interviews with the leadership and enrolled practices and residents, the consultation team. And Leah shared they don't use the names, just an anonymous primary care provider or a parent. Or and in Michigan, also recording some videos. And Rhode Island did a PSA, public service announcement, from a patient perspective to encourage reaching out to their primary care provider. So a lot of different ways that you can see that video is being used. And Juliana, I hope that answers your question. Yeah, I guess that does. But a lot of different opportunities to do that, and I would put the plug in whenever you're doing that was you can get someone to say, the survey wasn't that long. I'm glad I provided the feedback. I'm glad I could help my state or this program. Then that, again, just norms the need to provide feedback too, and that helps overall with what we're looking to accomplish. So those are all the pieces that we have to cover today. I want to turn it back to Madhavi and just see if you have any comments yet or closing remarks for us. Otherwise, I can do that.
Thank you so much, Susan, and thank you, Ashley, for presenting about MDRBD, and also to the awardees for your participation in today's webinar, and also your participation in the polls. You gave us some rich information, as well as your responses in the chat box. I think we're eager to take all the information that you've shared with us today and see how we can help you further with survey administration and completion, and also with data reporting. So with that, I'll just turn it back over to Susan. So thanks, everyone.
Okay, thank you. And I see there's a flurry of comments going on in the chat box right now. And what I would ask is that if you'd like to send us any of the, either if you have a link to a program, I see Rhode Island just put theirs in, but anything that you'd like to share, we'll make that available as part of the follow-up from this particular webinar, that you can see a number of those different ways that the materials are being used, and whatever we can gather, we'll be able to do that. Thank you, Gigi. Thank you, Jim, for already putting yours right in here for everyone to see. So we, it's a great way to be able to collaborate. So, thank you all for your time. As always, if we've got, you will receive the feedback survey, so be able to do that. And we welcome your feedback. And I hope everyone has a great rest of the day and you get a few minutes back of your time. And thank you for all the participation in the webinar as well. The discussion and through the chat was really great. Thank you. We got a couple more folks going on. We're going to stay on the line so everyone can grab the pieces out of this and be able to do that. Thank you, Bethany and Melissa. Appreciate everybody's help.
This concludes today's conference. All participants may disconnect at this time.